Good evening, guys. This is discussion E for you. We're discussing the holistic side of geriatric care. So here we go. The phrase prioritizing the 5 M's in geriatric care, a holistic approach to care of the older adult, refers to a comprehensive framework designed to improve the quality and effectiveness of healthcare for older adults based on surrounding page content from the American Family Physician editorial. This approach is rooted in 5 key domains, collectively known as the geriatric 5 M's. 1. Mind meditation focuses on cognitive and emotional health, addresses conditions like dementia, delirium, and depression, recognizes how emotional trauma, e.g., loss of a spouse, and physical incidents, e.g., falls, can worsen mental health. Encourages both pharmacological and non-pharmacologic interventions such as counseling and social engagement. 2. Mobility emphasizes maintaining physical function and preventing falls. Falls are common and psychologically damaging, often leading to reduced activity and increased fear. Promotes physical therapy and activity to restore confidence and prevent further decline. 3. Medications tackles polypharmacy, which is the use of multiple medications, a major concern in older adults. Encourages deprescribing and careful medication review to avoid adverse effects, drug interactions, and functional decline. 4. Multi-complexity recognizes the challenge of managing multiple chronic conditions and complex biopsychosocial situations. Advocates for care that balances disease management with personal values and health literacy. Warns against fragmented care and over resilience on disease specific guidelines. What matters most? Centers care around the individual's goals, values, and preferences. Encourages shared decision making and advanced care planning. In the case example, this meant respecting the patient's desire for independence and her passion for art. Why it matters. This holistic model is especially vital as the aging population grows and traditional healthcare systems struggle with fragmented solo care. The 5M's framework promotes interdisciplinary coordination, patient-centered strategies, and cost-effectiveness services. Unfortunately, ultimately aiming to enhance both the quality of life and clinical outcomes for older adults. It's not just about treating disease, it's about treating people. Absolutely. The geriatric 5M's framework offers a powerful lens for understanding and improving care for older adults. Here's a deeper dive into each domain based on the editorial from American Family Physician. Mind meditation focuses on cognitive and emotional well-being, includes conditions like dementia, delirium, and depression, which often overlap and worsen each other. Depression in older adults can double the risk of cognitive decline. Contributing factors: sensory loss, social isolation, and bereavement. Treatment may involve counseling, medication adjustments, and give me 1 second, folks. Non-pharmacologic therapies. Like physical activity and social engagement. Example: an older adult grieving a spouse and recovering from a fall may experience worsened depression and memory issues. Addressing both emotional and physical health is key. Mobility, focus, physical function, and fall prevention. Falls are common and costly, both physically and psychologically. Fear of falling can lead to reduced activity, which in turn worsens mental health and independence. Assessment tools and physical therapy can help restore confidence and prevent future falls. Example: after a fall, an older adult may avoid walking, leading to isolation and depression. Mobility interventions can break this cycle. Medications, focus, safety, and effective medication use. Polypharmacy, taking many medications, increases risk of side effects, falls, cognitive problems, and non-adherence. Regular medication reviews and de-prescribing are essential to reduce harm. Align prescriptions with the patient's current health goals and conditions. Example, a medication causing dizziness might increase fall risks. Adjusting or stopping it could improve both mobility and uh, meditation. Multi-complexity, focus, managing multiple chronic conditions and complex life factors. Older adults often face morbidities, e.g., diabetes, hypertension, depression. Disease-specific guidelines may conflict or overwhelm the patient. Care should be personalized, considering health literacy, social domains, and treatment burden. Example, instead of rigidly following every guideline, clinicians should prioritize what's most beneficial and and manageable for the patients. What matters most? Focus, patient-centered goals and values. Encourages shared decision making and advanced care planning. Care should reflect the individual's preferences, passions, and desired outcomes. avoids avoids unnecessary interventions that don't align with the patient values. Example, an older adult whose values independence and art may prefer treatments that preserve mobility and mental clarity, even if it means declining aggressive medical interventions. Together, these 5 M's from a holistic, integrated approach that respects the complexity of aging while centering care around what truly matters to each individual. Would you like help applying this framework to specific case or scenario? Great question. Applying the 5 M's to a patient case transforms abstract principles into meaningful, personalized care. Let's walk through how you might do this using a real-world example adapted from the American Family Physician editorial. Case example, 80-year-old artist, background, lives independently. Give me a minute, guys. Diagnosis, hypertension, type 2 diabetes, and hyperlipidemia, major depression, uh, depressive disorder, mild cognitive impairment, urinary incontinence. Recent fall while visiting her daughter, grieving the loss of her husband, passionate about daily walks and painting, mind meditation, mind meditation, assignment, assessment, mild cognitive impairment and depression worsened by grief and fall related to trauma. Action, screen for depression and cognitive decline, offer counseling, social support, and consider adjusting medications that may affect cognition. Mobility assessment. Fall has led to fear and reduced activity, impacting independence and mental health. Action, refer to physical therapy, assesses home safety, and encourages gradual return to walking. Assess fear of falling through confidence building strategies. Medications assessment, multiple chronic conditions, likely mean polypharmacy. Action, review all medications for side effects. Interactions and necessity, consider deprescribing anything that contributes to dizziness and confusion or incontinence. Multi-complexity. Assessment, multiple chronic diseases, plus psychosocial stressors, grief, isolation, fear. Action, coordinate care across providers, avoid rigid disease specific targets, focus focus on manageable goals that balance physical and emotional health. What matters most? Assessment. She values independence, creativity, and daily walks. Action. Align care plan with her goals. Prioritize treatments that preserve mobility and mental clarity. Discuss advanced care planning in a compassionate, empowering way, putting it all together. This approach ensures that care is not just clinically sound, but also emotionally and personally meaningful. The 5 M's help you see the patient as a whole person, not just a list of diagnoses. Would you like help applying this framework to a different patient scenario or building a care plan template? There's a wealth of caregiver training resources out there, whether you're just starting or looking to deepen your skills. Here's a created list of some of the most helpful and reputable options. Government and national organizations. Okay, HHS, Gov, Caregiver Resources. Offers links to caregiver support from agencies like Medline Plus, Medical Info, Medicare.gov, Caregiving with Medicare, National Institute on Aging, guidelines and worksheets, Alzheimer's.gov, dementia specific support, Elder Care Locator, connects you to local services. Okay, then there's VA, Caregiver Support Program, especially helpful for those caring for veterans. Free online free 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 online education models on Caregiver 101. And then for people that need this, there is there is also suicide prevention for for veterans out there. Navigating VA benefits, reducing stress and burnout, developed with University of Louisville. Then there's National Institute on Aging, Caregiver 101, offers downloadable caregiver handbooks. Topics include coordinating medical care, planning ahead, caring for yourself, exercise ideas for chronic conditions, tracking and delegating caregiver duties, bonus tips. Give me 1 second, guys. Local hospitals and nonprofits often offer free or low cost training. Check with your local area on aging. Medicare, Medicaid may cover some caregiver training costs. Look for support groups and online forums for peer-to-peer learning and emotional support. Would you like help choosing a training program based on your caregiver situation, like dementia care, mobility support, or end of life planning? I can tailor recommendations to your needs. Okay, guys, so that is it for tonight. I will see everybody tomorrow for shows. For now, Gator Wellness. Take care, folks.